Hello, good afternoon. Welcome to NORDIC Health 4.0, the Amplified Nurse. Today is our last day of presentation from the Nordic companies. Today we have one company presenting, Otivio, and this will be the presentation structure, 30 minutes of presentation followed by Q&A. So today we have Michael from Otivio who will be presenting. So for those who have missed the earlier presentation or want to watch today's presentation or share with your colleagues, just email to me. This is my email. My name is Nika from Innovation Norway. Mobile number and email. Just email me and I can send you the link for the YouTube channel. In fact, we have all the sessions recorded on YouTube channel, so you can watch it. So after understanding all these solutions from the Nordic companies, please get to your representative in the respective cluster to identify which company are of interest to you, because we will be inviting these companies to Singapore in September. So only those that are selected by you will be invited to Singapore. So if there are any other challenges which are not covered in this 2 weeks of presentation, please email to me as well. We'll be on a constant lookout for a solution for you. So there are a total of 17 companies presenting for these 2 weeks. These are the 8, and these are the remaining companies. So today is the last one from Otivio, a very, very interesting solution. I'm very passionate about this solution. So without much further ado, let me invite Michael to take over the screen. I will stop sharing now.
Well, thank you very much, Nika.
No worries.
It's a big pleasure to talk to you. My name is Michael Tauber. I'm the Chief Operating Officer for Otivio. And Otivio is a startup company based out of Norway. However, I'm a German citizen and I have joined Otivio about 1 year ago. I'm very passionate about healthcare. We'll talk about that a little bit later. And I will talk to you now about our device FlowOx. FlowOx is a device, as you can see here in the headline, that is enabling the treatment of lower limb blood flow deficiency. And we do that by using intermittent negative pressure. And what is so special about the device is what you already see on the picture here on your right, which is that we have a very easy to use, easy to apply home care application, as Nika is showing here. Thank you very much for that. If we move to the next slide, please, I have presented or prepared the following topics. First of all, I will give you a short overview about our small and relatively young company. Then I will talk a little bit about the medical background of blood flow deficiency, why this is an unmet need and why this is an important topic going forward. And then I will talk about our device FlowOx. I will give you a brief introduction about the product. I will talk about the usage and also the key value proposition. And I will also share with you some clinical results, followed by a voice of the customer. This is the 6th part of my presentation. And then very importantly, I would like to discuss with you or to inform you about ideas and plans we have for Singapore, for your very interesting and attractive country. And then finally, I would like to wrap it up with next steps and a summary, followed by a Q&A, as Nika did already mention. So let's start quickly with our company, Otivio. Otivio is a company that it was founded in 2010. The founder, Jakob Matthiesen, is still with the company. He is together with me and 2 other colleagues on the management team, and he is actually our Chief Scientific Officer. So he has a deep and long clinical background. And as you can see, in 2014, we had our first device, our first form, FlowOx 1.0. You can see it on the right side. It looks still a little bit experimental, but however, we did get a CE mark for that device, and we did our first patient applications. And 4 years later, in 2018, we were actually launching our fully industrialized commercial product, and that's also the one we still have today. In 2019, 1 year later, we were able to actually have the first product revenue. And then, as we all know, unfortunately, the global pandemic, COVID-19 pandemic, hit all of us, and this was for us quite unfortunate because we were about to scale up and to commercialize our product globally. And as we all know, it was very difficult, especially in the healthcare segment, to move ahead with new products, with new solutions. So it was very difficult for us the last 2 years. And so what we did in 2020, we focused on gaining more clinical evidence and to include more patients, to have more data, more clinical evidence. And last year, actually, we were preparing for the global rollout. We did also found 2 subsidiaries, one in Denmark and one in Germany. Germany is actually the one that I'm sitting now in. We have a small office in Munich, Germany. And for this year, one of our big goals is to start the global commercialization. And I'm very happy and proud that I have been qualified, or that we have been qualified and invited for this Amplified Nurse program. And we have very strong and clear plans to enter the market in Singapore in the second half of this year. On the right side, just to finish this slide, sorry, if you can just go back, excuse me, is our global headquarter building, or our head office. It's an old industrial complex in Oslo, Norway. I am usually going there every month. However, I am also traveling a lot these days in order to, again, promote and commercialize our product. Quickly to our management team. We have a team of, I would say, a very experienced and dedicated personnel. And just to name a few of them, we have Andreas Mollert on the left side, who is our CEO. We have Jakob Matthiesen. I already talked about him. He's our founder and chief scientific officer. Then we have Klaus Gjersgaard, who is Danish, by the way, who is our head of business development and strategy. We have myself, Michael Tauber, the Chief Operating Officer, and then we have 3 other colleagues for finance, for medical affairs, and then also Punit Patel on the very right side, a British citizen. So we are a very international team, and I would like to highlight that we have a very, very deep and strong track record in medical devices and healthcare in general. Myself, I am working in medical devices since '97. I started with a company that you all know, Philips. Later on, I was working for almost 10 years for GE Healthcare. And then I was working for another American company called ResMed. It's the world market leader for the treatment of sleep apnea and COPD. And prior to my new position at Otivio, I was working for a dental company called Ivoclar Vivadent. So I think we all are very passionate to bring devices to the market and to actually help different stakeholders, help the patient with a better quality of life, help the healthcare professionals with giving easier and more direct treatment opportunities, and finally also help the healthcare system with having more affordable and more effective treatment aids. Good, this is the motivation. Now quickly some background to blood flow deficiency. As you can see on the next slide, it's a quite busy slide. I would like to just focus on the left side here. We have about 50 million people globally that suffer from blood flow deficiency in a form that you need to treat it. And there are 2 distinct clinical situations that are going in this direction. One is peripheral artery disease, PAD. Thank you very much. And then you have diabetes mellitus. And these are the 2 distinct clinical situations that are actually bringing the patients to our device. And as you can see, funneling down on this chart, some of them, depending on the severity of the blood flow deficiency, will even have critical limb ischemia, CLI, and this can ultimately lead to the loss of limbs. And as we all know, of course, this is a very, very severe disease, and we would like with our device to help to stop the progression of PAD, to stop the progression of diabetes mellitus, and to save, at the end of the day, limbs to the patients. And as you can see on the right side of the slide, quite comparably to my previous position at ResMed, where we have obstructive sleep apnea, we talk about a lifestyle disease. We have, unfortunately, in the Western industrialized world and Eastern industrialized world, we have a lot of people that have lifestyle diseases that come from smoking, not enough movement, too much food, all of that. And unfortunately, the treatment options for PAD are not very let's say diverse. We have a lot of people, as you can see on the lower right side, that are not suited for revascularization. We have a lot of amputations, and unfortunately also the mortality rate for 5 years is quite high. So I think our device is addressing an unmet need. I will talk about that a little bit later, but these are just some numbers. And if we go to the next slide, also to talk about the effect for the overall healthcare systems, just to, I would like to concentrate here on the first two numbers that you see. The 136,000 euro, which is approximately 190,000 Singapore dollars, is the lifetime cost for an amputation, and 120,000 euro, so approximately 155,000 Singapore dollar, is the lifetime cost for mood management for PAD. So we are addressing a really significant cost driver with our device, and when we are able to cure and to help patients with PAD and diabetes mellitus, this will not only have a big effect on the patient population, it will not only have a big effect on the healthcare professionals, on you, it will ultimately also have a big effect on the overall healthcare system and the society. Next slide, please. Yeah, as I said, we are addressing an unmet need, and unmet need means that we have a device that is helping with inadequate and limited treatment options. And what I'm not saying is that FlowOx is addressing or is replacing everything that is available. No, this is not our positioning. Our positioning is that FlowOx will help as an additional tool, as an additional treatment to help the first-line treatment for wound management, for example. See here on these photos, you see the typical disease progression. In PAD, we talk about the so-called Fontaine scale. The Fontaine scale has different severity areas. It goes from 1 to 2A to 2B to 3 and finally 4. And what we say is that our FlowOx device is especially addressing Fontaine scale 2B, 3 and 4, and 2B is defined by disabling walking pain. You see that in the middle of the photos here, and then you have ischemic rest pain, you have chronic wounds, and finally even gangrene. And this is where we see FlowOx as a baseline therapy, and it can then be, of course, added with other or combined with other therapies like medical therapy, surgical intervention, wound care. And what we would like to avoid, once again, is that we have finally amputations, that we have finally the loss of limbs, and we would like to help with the FlowOx treatment that the Fontaine scale is not progressing, that the progression can be altered, and hopefully can even be reverted back to some better disease stages. So with that, let us go to the product now. I would like to introduce FlowOx to you now. And as you can see here on the right side, we talk about an advanced home treatment. This is very important. Of course, the start of the treatment can always and will, in most cases, always be in the hospital environment, but the distinct application of the device will be in home care. And the reason for that is also that the treatment duration is about 90 days or even more. So our recommendation for treatment is for a period of 90 days or 3 months. And during this treatment area, you would use the device for 2 hours a day, 1 hour in the morning, 1 hour in the evening. And as you can see here very nicely on this photo, you are able to, during the therapy, to do different things. You can read a book, you can listen to music, you can even have dinner, for example, or watch TV. And it's a very easy to apply therapy. I will come back to that later. And if you look at the left side, these are technologies also using intermittent negative pressure, but it's a very more complicated device. And as you can imagine, it is also much more costly and much more inconvenient for the patient, because the patient would actually have to come to the hospital or to this treatment center every day, maybe even twice. And so we think that we are actually addressing a sweet spot with our device. If you go to the next slide, please. Yeah, what is the technology? The technology actually is that we are using so-called pulsating negative pressure, as you can see on the left side of this slide, and we are using a rhythm that you can see on the lower side of the left slide. And what we are doing actually is we are changing the pressure in the pressure chamber every 10 or 7 seconds, as you can see here on the graph. So we have 10 seconds where we will have negative pressure of minus 40 millimeter mercury, followed by 7 seconds of normal atmospheric pressure. And by doing so, over time, for 1 hour in the evening and for 1 hour in the afternoon, or 1 hour in the morning and 1 hour in the afternoon, we are actually sucking blood in the arteries that have not, or just not only poorly be supplied with blood. The device itself, as I said, is quite easy to use. You have 3 or 2 parts. One part is the control unit that you see here. I brought one with me. The control unit is very easy to use. It's a one-touch operation, as you can see, and also very important, it's a multi-patient use device. So after a patient has used this device, this control unit can be cleaned, can be refurbished, and can be given to the next patient. Then the second part of the solution of our system is the pressure chamber. Some people call it boot. It is actually where your feet will go into, and where we will have the application. It is closed here with a seal, so that we can really apply this negative pressure. It is, however, a single patient use, and this is because of hygienic reasons. One boot, one pressure chamber stays with one patient normally, but the control unit, as I had said, can be reused with different patients. And then, of course, we have a refurbishment kit, which consists of different parts, especially here, different seals. Inside of the device is a so-called padding. It inflates in order to better stabilize the leg. And we also have this tubing and filter to apply the air. And this is typically what is a part of the refurbishment kit. If we can move to the next slide, please. So the value proposition of the device is quite easy. It is proven, it is intelligent, it is convenient and affordable. And what we mean by that is the following. We have, during the years of 2018, 19, and 20, collected a lot of clinical data. We have documented the success, the effect of the device in order to reduce pain, to heal wounds, and at the end of the day, save limbs, and by doing so, improve the quality of life of the patients. It is also intelligent, and what I mean by that is that we use a USB stick right now in order to read out data. So the healthcare professional can actually monitor the compliance of the patient, can see how adherent the patient is, and to give you a little bit an outlook, the next version of the device is that we will have also a device that will be connected to the cloud. So the next version will send the usage data automatically to the cloud so that it can be telemonitored, meaning that the healthcare professional or the home care provider can even better look at adherence rate of the patient. Then, as I said, it's very convenient. As I said, in most of the time, the start of the treatment will be in the hospital setting. However, then the device travels with the patient to the patient's home where it is installed and used. And normally, typically, the patient can use the device on his own or on her own. There is no need that a healthcare professional will be with the patient every day. Normally, it is very intuitive and easy to use for the patient. Even if you have an aged patient which is older, it's still quite easy to use the device. And last but not least, it's affordable, and I think this is one of the drivers that we see in general in healthcare today, is that we need to really drive down costs with the population which is getting older and older. At the same time, we are trying to move treatment out from the hospital to patient homes. So I think we are really addressing two major needs or two major factors of today's healthcare. Good. Now, after this introduction, I have prepared a small video I would like to share with you. And Nika, if you can go to the, sorry. This is, there's one more slide before the video. Excuse me for that. The next slide is showing some different alternatives. However, I have to say that we have no 100% competition. There is no device existing globally that uses intermittent negative pressure for a home care application. So in a way, our Otivio FlowOx device is unique because it's the only device that brings intermittent negative pressure to the home care setting. We have some commonalities with pneumatic compression, as you can see on the fourth column. We also have some commonalities with the intermittent vacuum therapy that you see on the first column. However, once again, our device is really unique, and that's why we are so passionate about it, bringing it to the markets going forward. And once again, the big advantages are that we have a clearly documented efficacy of our healing of wounds and healing of PAD. We have a low cost structure compared especially to solutions in the hospital, and we have also a high adherence or compliance rate of the patient. And now, sorry for that, now we would like to see, to show you the video of the usage. What you see in the video,
find a good chair and sit comfortably. Fold the
is actually my colleague Jakob.
You can
so Jakob, the founder of the company, is actually showing how the device is used.
Foot on the footrest and align it so that your calf is almost all the way.
This is now the padding. This is inflated in order to have a better stability.
Up over your calf,
and then you close the device with the seal.
With your skin all around.
The seal is typically lasting about 1 month, and the device comes with some spare parts also that you can reduce the seal in case it is broken.
Press the stop button. Fold the seal back over the edge of the pressure chamber.
The usage is very easy. Again, it's one button usage.
While you press your foot back and use your hand to release the air caught in the padding. Remove your foot. Fold the seal back.
Yeah, in order to keep the tension of the seal, you're folding it back, and then it's ready for the usage. So it's really simple, and we have in the meantime since 2019 we have actually treated more than 500 patients, most of them in Scandinavia and in Germany, and 500 again, and we have found that it's really easy to be used. Now, talking a little bit about the clinical results, we differentiate between the acute effect and the long-term effect. And the acute effect is that we are increasing, we are increasing the macro and micro circulation of the blood, and this leads to an increased blood flow to the lower extremities and to the skin. So in a way, arterias that have not been or have only been poorly been oxygenated get this oxygen now due to this increased macro and micro circulation. And this leads to an increasing oxygenation and the nourishment of tissue. And this actually leads to the restoration of the endothelial function. And this then, if you do that for several days, and as I said, we recommend the usage for 90 days, we have a long-term effect, which means that we have a better rehabilitation and healing process. We have also the clinical benefit, number 2, that we have a reduction of pain. We have a increased mobility of the patient. The patient have less or no walk-in pain. We have reduced edema, and at the end of the day, we are able to save limbs by reducing the number of amputations. I have 2 cases brought with me quickly. I think in the interest of time, I will be quite fast here. You have access to these slides, but here we have two patients. Both come with wounds, and you see that the wounds after 8 weeks of usage have been dramatically improved. So the wound B has been closed completely after 8 weeks, as you can see on the lower part of the slide, and the wound A has been dramatically reduced in size. And also the ABI has been improved over time. In the second case, we have a different example. We have a patient suffering from diabetic mellitus, PAD, and here we can also see how we were able to help with the curing of wounds. And also the ABI has changed significantly from 0.77 to 0.97. And yeah, due to this improved situation, the patient was able to go for a renal transplantation. These are just 2 examples. We have a lot of more clinical data. If you are interested, myself or Nick Care will be able to share with you our clinical overview. We have a clinical overview where we have collected all the data, all the publications that we have done. Most are coming from University Hospital in Oslo and in Norway in general, but we have also publications from the UK, from Germany. So we have a lot of clinical data that is available upon request. Now, before we already come to the final part of the presentation, let us also take a look at the voice of the customer. Please, if you could start the video again, and please look at the text, because the language will be in Norwegian. But yeah, maybe we can just have a quick look.
Michael, I think this one doesn't play.
Okay, you cannot start it?
Yeah. Let's continue, then I'll try to find it on YouTube. Yeah.
All right. We will, I think you can anyway find it, or we will be able to provide you the link to see that it's a YouTube video. So, moving now to Singapore and to the Amplified Nurse Program. Why do we think that this product qualifies very well for your program? Well, as I said already at the beginning of my presentation, there are 3 parts that we address with FLORX. One, I think the most important for you is the one at the bottom. It's the health provider burden. I think that we all, and especially due to the Corona pandemic, we have an exhausted team. We have a lot of burden on the nurses, on the overall healthcare system. And we think, or we are confident, we believe that FLORX is able to help you with that, because we are shifting treatment from clinical to home, and we promote self-care, meaning that the patients can help themselves and are motivated to experiment with the device, to use the device in their own home setting. Then We will also have the cost effect once again. We will be able to reduce the burden of current standard treatment. As I had said, the lifetime costs for amputations or for wound management of PAD patients are significant. We talk about more than 100,000 Singapore dollars, and we are able to contribute and to help driving down these costs. And of course, we also would like to eliminate amputation. And finally, don't forget the patient. The patient is able to help himself or herself at home. We have a highly effective and easy to use application, and it's also affordable even for patients if they decide to pay out of pocket for this treatment. So what are the next, what are the things we would like to do? If we can move to the next slide, please. Okay, this is the video. Yeah, maybe we can have a quick look at the video. Thank you. Perfect. Please look at the text below, which is in English.
Jeg heter Grete Valsgaard Hetland. Jeg 43 år gammel og kommer fra Sandnes. Jeg har jo amputert tær, så jeg vet jo hva fantomsmerte og jeg må bruke smertestillende midler for I hele taget komme meg opp av senga. Jeg ble jo sittende I rullestol I 3 år.
Grete is still using her device. I was in touch with Jakob before, and he confirmed that she is still using it.
Så selve foten. Hos huset sendte vi barmen second opinion I Oslo, og de kikket på bildene og mente at det ikke var noe mer å gjøre sånn som vi hadde vurdert I forhold til å øke blodsirkulasjonen. Men
if you go to our website, you will find more patient stories, because as you can imagine, this is the core of what we are doing. We would like to help patients. We would like to make sure that we have positive patient outcomes. I think that's enough, Nicare. It's just a brief overview. And again, we are having very touching stories, and I think that's all what drives us, especially you as healthcare professionals, is to help these patients. So what we are actually doing is we are driving cost saving and we are driving efficiency gain. And as I said, first bullet here is that typically FlowOx will be applied in the hospital and then transferred to home environment, which means that we can discharge patients earlier from the hospital, which is a high value. Then we can give more power, more self-esteem to the patients, meaning that you have time, the hospital staff has time for different patients, for different important things to do. We also see FlowOx as an alternative to so-called supervised exercise therapy, which is sometimes a little bit difficult to give, and we are able to avoid complications, for example wounds, and we are able to improve or even expedite the wound recovery, and this again leads to a higher quality of life and to the saving of limbs. And so what do we concretely offer to you? What are the next steps? What have we proposed for you? So we are very interested, Otivio is very interested to partner with the healthcare system in Singapore in order to augment the nursing manpower and skill sets, in order to give back time to the amplified nurse and to help you actually solve the challenges of today's healthcare system. We are already today collaborating actively with Innovation Norway, and we are also a member of the Innovation Norway Tech Lab in Singapore. And as I mentioned at the beginning, we will have FlowOx demo units on site in Singapore in the second half of this calendar year. And we would like to offer you to do product demonstrations. And I can already say now a very big thank you to Nicare. I was working on this presentation actually, or on this preparation for this presentation with Nicare very, very closely. And yeah, he is a great advisor. Once again, thank you very much. And we would like to yeah, be able to show the device in real time, in reality, to many of you after the summer break or in the second half of this year. So in summary, I think I was able to show to you that FlowOx is non-invasive, it's comfortable, it's easy to use, it's affordable, and it's tailored for home treatment. And my final slide, FlowOx, the pulsating negative pressure therapy for home use. It is non-invasive, comfortable, and easy to use a medical device for affordable home treatment. And once again, thank you very much for your interest. I'll be happy to take any questions. Here you see our contact details, my contact details, and the contact details of KneeCare. And we would be very, very happy going forward to also come to Singapore to visit you, to start some product demonstrations, and to get this great, innovative, novel technology to many patients in your country. Thank you very much for your attention.
Thank you, Michael. Okay, without much further ado, let's start the Q&A session. So you can unmute yourself, or you can actually type it in the chat.
Hello. Yeah, thanks so much for the sharing. Yeah, could I ask a bit more on the cost structure? Is this a per product cost, or do you actually do rental of this product to hospitals?
Yes, we do both. The go-to market would be that we actually would like to identify and appoint a distributor in Singapore. So we don't think that we will have directly an own Otivio company in Singapore, but this will now be one of my major tasks, is to find a company that is partnering with us. And typically how this would then work is that we sell the device to this company, and this company then will rent it out to the hospital or to the patient.
I see. Okay, thank you.
You're welcome.
I think Michael also have the option of, if the hospital find that they want to go by CapEx model of purchasing the device, I think that's also another option. So basically, correct. I think his business model is very flexible.
Correct. So we can have a CapEx model and we can have an OpEx model. Also in Europe, where we are already having several customers, we have also both options. So we have some that are renting. We can have a daily rate, we can have a weekly rate, we can have a monthly rate, or we can also sell it directly to the hospitals or to the home care or healthcare professionals.
So as Michael has mentioned, the demo units are actually on the way, probably in the plane already, on the way to Singapore. So I encourage the nurses who are keen in testing out this, or you can engage your clinicians or your therapists to be involved as well, so that you can evaluate the product together.
That would be our goal, because you can always have a nice presentation. Again, I'm working in medical devices since 25 years now, and you need to see it in live. You need to be able to touch it, to operate it, and that's what we would like to do with you when we have the devices in Singapore. Any other questions or comments?
Hi, thanks for the presentation. It's Maxim again. Yeah, I would like to ask, because Asians are probably generally shorter, and may I know what is the length of this device and whether it's customizable to different length of the limbs? Yeah.
Yes, that's a very good question. So the device itself is not customizable for the length of the pressure chamber. However, we have inside a foot positioner, and the foot positioner can be changed in order to accommodate different sizes of feet. And I think that for Asian population, which has I think I'm not telling something wrong here, has in general smaller feet than Caucasian. I think that fits very well, that we can have a smaller foot in here. And then again, very important is that we have this sealing here, that it closes on the lower limb, and this is also no problem. We have had no patient problem with that at all.
Okay, thanks very much.
Question.
Thank you.
I think that will be a very good feedback after we can loan the unit to the hospitals. They can try on different patients of different sizes. just to ensure that the mechanism is still tight enough to be
Correct.
vacuumed, yeah, so that the pressure
Correct.
is still maintained.
Absolutely.
Okay, so it means the blue piece underneath to maybe prop up the leg a bit more comes in different sizes lah.
No,
So it may be
not in different sizes, but it can be. You cannot see it. I don't know if you see it here, but it can be moved inside the pressure chamber so that the different foot sizes can be accommodated.
Understand this. Okay.
So
Yeah.
Michael, do you mean you can put something below that blue piece to elevate it?
Correct. We can also do that. Yeah.
Thanks. Okay.
You're welcome. Thank you. Any other questions or comments? I'm really happy to answer all the questions you might have. Okay, so hopefully this is a good sign that everything was understandable. And yeah, once again, thank you very much for your interest, for taking the time. I'm sorry for the technical difficulties at the beginning. I hope that it was worthwhile waiting a couple of minutes longer. And thanks again to you, Nicare, and to Innovation Norway and the Tech Lab for making this possible.
Thanks, Michael. Yeah, thanks everyone. So again, here's my contact. Yeah, you want to try out the device, just drop me an email. So once the device comes in, I can arrange to bring it down to your site. And so that's all for today. And in fact, that's all for the whole sessions of this NORDIC Health presentation. So I would like to thank Michael and thank everybody for your attendance, and have a good day. So see you again. Bye.
See you all. Thank you very much again. Have a great day or a good evening. Bye-bye.